Good morning, good afternoon actually, from New York City. This is Dr. Lana Marrow calling, and I will be delivering a talk on neuroeconomy and how it impacts neurodegenerative disorders, magnitude of cost internationally and nationally. I have been giving some talks on neuroeconomy now for more than a year. I think working with neurodegenerative diseases and with speaking with Moses Chow and a few other people who are interested in economic impact on and loss of productivity due to neurological or neurodegenerative diseases, we all understand and agree that the loss is of staggering proportion, and we have as individuals, previously, I think people have not paid attention to the magnitude of the impact of productivity loss and economic burden that neurodegenerative diseases pose on everyday life and economy, global and national. My name is Dr. Lana Marrow. I'm a neurotechnologically geared neuroscientist. I have a few inventions behind in my history. Practically, I try to invent new devices that enable people to transmit the thought to the software and computers, iPads, PDAs, and therefore enable faster and less economically burdened research globally and nationally. We work with several institutions abroad and here in New York City. Namely, I interact with some people from Columbia University, where I was trained with Jakob Stern, and we interact with, we actually do a lot of research with St. Pau Hospital in Barcelona, as well with, we have some research planned now with PT Salpêtrière in Paris, both in the domain of frontal lobe functioning and cognition, working memory, sustained attention, overall cognitive reserve, and you know, we are right now working on research in ADHD, attentional capacities, sustained attention, and we have planned several studies on Parkinson and healthy aging. Today, I would like to speak about the neuroeconomy. The field of neuroeconomy is very young. We need to raise awareness of the impact of the neurodegenerative diseases on economy, and people usually are not aware of how meaningful neurotech and various new technology could actually be for neuroeconomical impact in the world and on everyday lives. You may wonder, how does the neurotechnological systems, how does a neurotechnological system impact the neuroeconomy? It is not very obvious at the first sight, and I'm going to try to explain to my best ability. If you have a neurotech device that works and is enabling you to reach, as a medical professional, is enabling you to reach thousands of people at once without them having to travel to you, or you have a significantly reliable, research-proven data pool bank and capacity through neurotechnological devices to actually access your patient and enable this route between communication between patient and the provider, and you plug that into the insurance cost as well, we are able to prove that the costs of economical burden is definitely much less. the diminishing of the costs benefits not only the provider or the insurance agents, but it benefits first and foremost um, the patient or the subject. They can be healthy patients, healthy individuals who just want information. They can be researchers who would like to join hands internationally and access multiple thousands of patients at the same time and access reliable data. And we all know that reliable data monitored by computers can give you more specific values. Namely, it can, just a banal example of rehabilitation. If you rehabilitate a patient after a sports injury or after a spinal cord injury, you can monitor their data in hospital, and all is well while you have a reliable doctor or technician who is in the hospital and who monitors the patient's progress. Again, this is not very scientific. Still, it's not comparable to the data on fMRI or data that are derived from, let's say, a gate platform. But still, it's more reliable than when the patient goes home and reports to you that he has done, he has followed your chart and has performed several exercises. We don't know, the researchers really don't have any ways of knowing exactly how many exercises the person really performed, to what quality level, to what repetition level, in what positioning of the body. People have to simply trust each other. Now, if there is a exact and precise, highly defined and highly reliable technical or neurotechnical gadget or device in place, in order to perform those exercises, the patient, even at home, has to adhere to a certain standard of the protocol, and the data is logged into the network, into a system where the provider then can reliably actually access the data and get the data evaluated down to a millisecond and with precision of a millimeter, which is then quite valuable for research. Dr. Thomas Insel has spoken. He's the National Institute of Mental Health director. He speaks on estimates of global economic burden and standard cost of illness methods, macroeconomic simulation, value of statistical lives. There are different economical approaches to valuing economic burden over various decades. Of course, this is a framework primal and crucial importance in governmental institutions, because we tend to not really think immediately about indirect costs and cumulative output loss of and burden in the world or in the United States. In order to progress and be able to really access multiple millions of patients and subjects, persons, we need to be able to effectively cut the costs, and all while having reliable capacitors and reliable measures of gathering the data, such as reliable devices, reliable technological systems and software programs that are actually statistically validated and tested, and not just presented as programs that have been invented by some digital programmer and not validated and not tested. Just like solid scientific studies, these data gathering systems and devices, as well as software programs and capacitors, have to be tested and run through rigorous scientific studies so that we know precisely that they are not reporting some random data, but there is a mathematical, statistical, and medical validity that is replicable and validated through institutions that we trust. And as such, I think so far I don't personally know of any systems that are really have been on the digital side have been actually medically and technically validated to the level that we can say there were rigorous studies conducted, and we actually can trust this data. And that's, I think, one of the very important standards, industry standards that we have to impose when we talk about helping the economy and medical community achieve better levels of savings and better levels of efficacy of reaching, multiple goals of not only providers but also patients. World Health Organization data show that mental illnesses are the leading causes of disability in DALY, suggested life years worldwide. When I read the numbers, I was extremely surprised. 37% of healthy years lost derive from income loss due to mental health illnesses. They affect directly and indirectly not only the person who is suffering from mental health illness, but also the companies they work with, the families, their caretakers, their family members. Depression, for example, accounts for 1/3 of this disability. Estimates of the global cost of mental illnesses are at nearly $2.5 trillion. That's a staggering number, and just in 2010. So these are somewhat older data, but they're reliable. The entire global health spending in 2009 was $5.1 trillion. And that compared to annual GDP for low-income countries is less than 1 trillion. So that's 5 times more than annual GDP. The numbers are tremendous. And I think that's probably for governments, that's one of the important ways of possibly saving trillions of dollars, and all while saving money to the government, saving money to the taxpayers, saving money to the people who are affected and who could possibly then have to pay much less in insurance costs and have effectively much more direct contact with their own doctor, whether they're in England or Italy, whether they're on war fronts in Africa. We could actually enable people to communicate with each other much faster, to be able to diagnose faster, to pass some of the preliminary exams screening in a very efficient and reliable way, all while also still having access to their own provider at a fraction of the cost. If we have the technology that is validated and standardized to the world standard, then approved by World Health Organization or NIMH or NIH. Brain disorders have accounted for humongous numbers. These are the brain disorders numbers in Europe. So we have in Europe, 798 billion in 2010 in total cost in Europe only of disorders of the brain. And here are numbers broken by anxiety, 74, 105 billion are in Europe of dementia just in 2010. Parkinson's accounts for 13.9. TBI is a big problem. It accounts for 33 billion euros just in 2010. Mental retardation, we all know that if your child is born mentally retarded, he cannot or she cannot really take care of themselves when they're an adult, and they're economically burdening imminently, their caretakers, their parents, and whoever is assisting them, and the society. So if we can prevent any of that or mediate it to the level that actually we can help it remediate on some better levels, more efficiently, cutting costs, not only to the families and directly affected patients, but also to the society, that would be important. The numbers for USA, we have here for ADHD. These are areas I'm personally interested in and have given numerous talks on, so I'm familiar with these numbers. These are the numbers derived from NIMH. 6.4 million children and 10 million adults are affected by ADHD, attention deficit disorder, meaning they can't pay attention, they have to be on drugs, they have to be, or they have problems, they create a problem in classroom or in the family, especially when the problem of attention is pronounced. Hyperactivity can become quite a difficult disease to tame, and or manifestation of a disorder to then manage. The numbers are about quite high. We have about sources here of 9 billion sales of stimulant in 2012. So we know that the numbers seem to be overly, the stimulants are overly prescribed, and that seems to be a consensus now, partially because there are not too many rigorous studies conducted, and now we have more and more rigorous studies being conducted on ADHD and double-blind studies that are really truly necessary to assess what really encompasses the attention deficit problem or issue, and how can we address it in ways that are not just medical, but also behavioral, or through frequency-specific training. There are many different trainings now in the field that are being explored, and NIH and NIMH is allocating more and more grants now to help fund better research. In Alzheimer's disease, we have about 5.4 million Alzheimer's patients in the USA, 36 million globally. By 2030, NIMH predicts that it'll surge to 150 million Alzheimer's patients in the world, in the USA. The cost to the society right now is humongous. We're talking about $200 billion of annual cost to society, and 70% of that are covered by Medicare and Medicaid. And that's the source. Source for that was Alzheimer's Association 2012. In Parkinson, we have similar data. Parkinson's Disease Foundation in 2013 reports that there is 10 million people globally affected by Parkinson's disease. About 4% of that are ages 16 and above, and they spend a tremendous amount of money annually for medications. Per patient, there's a surgical intervention. Now we know that you can, undergo surgical intervention. This may be or may not be successful. The rate of success is not tremendous, although the numbers are growing daily, and we're very grateful for that. The numbers are huge again, in hundreds, thousands of dollars for surgery per patient. If we can find some more feasible methods, that would be wonderful, to improve and increase amelioration in patients with Parkinson. In sum, over 2 billion people suffer from brain-based health and productivity loss, which translates into $2 trillion of economic burden. So the red flags are everywhere, and we know that in the world, people are really eagerly trying to ameliorate the situation of economic impact of the burden of neurodegenerative diseases in the world. Going to slide 16. 18. How can we prevent that? Prevention and treatment saves the cost. So if, for example, in schools, we're giving training to children to whether it's behavioral or training through neurotech technology that now proves to be ameliorating children's capacity to focusing, children feel more successful at school. Our data prove that the children are increasing their scores in school by at least 1 point. They feel happier. Teachers and parents report better behaviors on brief and Connors. We have various statistically significant results on validated scales, and not only on scales, but also behavioral data and fMRI data. Children become less aggressive. As a result, they grow up to be stronger adults, less probability of depression, alcohol, drug abuse. Similar data, not by our group, but other groups showing post-traumatic stress disorder in adults. Soldiers in war have repeatedly, responded positively to treatment. That decreases cost to the society. NIMH now is funding some grants on post-traumatic stress disorder, on now traumatic brain injury as well. TBI data are very important. And this is just one short study. Otmar and Villanova, they have brought some of their systems to the war zone and measured soldiers with PTSD. And we see this is one of the graphs that they show with concentration and everything ameliorates in a very short amount of time. This is about a month of treatment. I think they were training soldiers 4 times a week, and they perform, soldiers performed and report much better focusing and much better relaxation capacity. This was done with alpha wave treatment and training simply for better focusing and better relaxation. Mayo Clinic shows tremendous results with, I don't have a slide for Mayo Clinic here, but we all know that they have achieved tremendous results with lowering the high blood pressure with just simple breathing devices and breathing techniques. They're not very sophisticated, but they work. At long distance, you can actually measure the data. You can plug that breathing, technique even into the computer, and the provider measures, breathing rates and breathing and the I think pulse rate. There are various software programs now that Mayo Clinic is putting a lot of emphasis on in order to lower the blood pressure and lower the stress levels. So we know that stress levels, if we lower stress levels, lower the blood pressure levels, we can actually impact the anxiety levels, and there is direct correlation between anxiety and concentration, and we can improve people's well-being also through those techniques. Again, they can be used in concomitance with medication. They can be used long distance, but I cannot emphasize more the fact that we need to have better double-blind studies, more validated data, and more validation, not only at the level of data of the study, but also validation of the devices and the software programs. Those software programs and techniques have to be treated just like a medical drug. They have to be undergoing medical studies that are rigorous, double-blind, and sham-proof, and only then we can actually claim success for those studies. And that is a field that should be opened and should be funded as well. We work with Columbia University and collaborate with NYU, PT Salpêtrière, La Sapienza, and St. Paul. We do believe that it's really important to perform double-blind study always, that is sham-proof and that is technically validated. We're trying to set up the standards that we hope will be followed at the level of, not only at the level of Neurotech and BCIs, which right now we don't know of many that follow those kind of high rigorous standards, in part because it's rather difficult to design a study that is double-blind and sham-proof when you have a high-tech Neurotech gadget device. But also people are not educated when it comes to the Neurotech or health tech biotechnology software. They do not think that it's necessary to perform double-blind validated studies, and I think it's imperative that those standards be put in place in order to then globally help people and get used to the fact that we can actually perform evaluations and treatment long distance, and which would then cut costs. I'm going to go to slide 2. So, for example, in neurotech, right now we have these kind of caps that are being used in the setup. So that means that the patient has to go to the hospital, to the clinic, and get wired. It takes about an hour of technician's time. It has about an hour or half an hour at least of a neurologist to come in and assess all of measuring the data, analysis of the data. Of course, they're plugged into real AC/DC current, and they have to stand still. That's not very practical, and the cost is I think about $8,000 per session of about an hour and a half. We propose something like this. We already have numerous studies that our study shows results that are fantastic. We have about 52% increase in target detection and 50 to 54% decrease in omission of the targets. So showing the fantastic data that are also revealed on comparative on fMRI data that show that there is a significant increase in capacity to train, to focus and sustain focus for a prolonged amount of time after using a treatment with sustained, neurotechnological device that is rigorously tested and can be operated long distance via a PDA, like an iPad or iPhone or a computer, and plugged into then a database that is in a hospital and that any provider can access. I'm going to go back to the slide that I think is crucial for this talk, that we would like to cut down this humongous $2 trillion economic burden, and based on the neurobehavioral diseases losses. And I think that that's what we have been talking to NIMH and NIH, and I think that is significantly important in order to be able to promote level of validation of new neurotechnologies in the world that could help not only millions of people around the globe, but could help our economic situation. And this is just one of the ideas that we have, and we're plugging forward with that. Personally, we have an annual award that we give, a Lifetime Achievement Award, to prominent researchers. This past year, we gave TIC award to Dr. Christophe Corvol, who conducts significantly large studies on Parkinson. And he is one of the people that we work with, and who promotes the idea that neurotechnology is important and will be the cutting edge of the next decade. We're trying to help neuro research, and we support the research in non-for-profit arena as well. And we're very, very grateful to be able to work with world level neuroscientists at the top level of technology and neuroscience. And we've reached the disciplines. I think that's very, very important to create large groups of people who can actually work together and collaborate truly and support each other. On that note, I would like to conclude the talk and open the debate for question and answers. Thank you.